Antenatal care. Antenatal care can be defined as a care provided by skilled healthcare professionals to pregnant women and adolescent girls in order to ensure the best health condition for both mother and baby during pregnancy. The first antenatal care visit occurs before 12 weeks of pregnancy, the second about 26 weeks, the third around 32 weeks, and the fourth between 36 and 38 weeks of gestation. Thereafter, women are advised to return to antenatal care at 41 weeks of gestation or sooner if they experience danger signs. Antenatal care models with a minimum of 8 contacts are recommended to reduce perinatal mortality and improve women's experience of care. The components of antenatal care includes risk identification, prevention and management of pregnancy-related or concurrent diseases, health education, and health promotion. A positive pregnancy experience is defined as maintaining physical and social cultural normality, maintaining a healthy pregnancy for mother and baby, including preventing and treating risks, illness, and death, having an effective transition to positive labor and birth, achieving positive motherhood, including maternal and self-esteem, competence, and autonomy. Antenatal care includes nutritional interventions, maternal and fetal assessment, and preventive measures. A healthy diet. Here you can see using vitamins and microelements suggested by the World Health Recommendation. A healthy diet contains adequate energy, protein, vitamins, and minerals obtained throughout, though the consumption of a variety of foods, including green and orange vegetables, meat, fish, beans, nuts, whole grains, and fruits. It is highly recommended point 1.1 and point A 2.1. The counseling about healthy eating and keeping physically active during pregnancy is recommended for pregnant women to stay healthy and prevent excessive weight gain during pregnancy. And daily oral iron and folic acid supplementation with 30 milligrams to 60 milligrams of elementary iron and 400 micrograms of folic acid is recommended for pregnant women to prevent maternal anemia, puerperal sepsis, low birth weight, and preterm birth. The undernourishing population nutrition education on increasing daily energy and protein intake is recommended for pregnant women to reduce the risk of low birth weight neonates. These recommendations have a context-specific tone. In undernourishing population, balanced energy and protein dietary supplementation is recommended for pregnant women to reduce risk of stillbirth and small of gestational age neonates. Also have a context-specific tone. In undernourishing population, high protein supplementation is not recommended for pregnant women to improve maternal and perinatal outcomes. Intermediate oral iron and folic acid supplementation with 120 micrograms of elemental iron and 1,800 milligrams of folic acid once weekly is recommended for pregnant women to improve maternal and neonatal outcomes of daily iron is not accessible due to side effects and in population with anemia prevalence among pregnant women of less than 20% and also context-specific tone. In populations with low dietary calcium intake, daily calcium supplementation 1.5 and 2 grams oral elemental calcium is recommended for pregnant women to reduce the risk of preeclampsia as a context-specific recommendation. And vitamin A supplementation only recommended for pregnant women in areas where vitamin A deficiency is a severe public health problem to prevent night blindness. Also have specific recommendation. Zinc Zinc supplementation for pregnant women is only recommended in the context of rigorous research. Multiple micronutrients supplementation is not recommended for pregnant women to improve maternal and perinatal outcomes. Vitamin B supplementation is not recommended for pregnant women to improve maternal and perinatal outcomes. Vitamin E and C supplementation also is not recommended for pregnant women to improve maternal and perinatal outcomes. Vitamin D supplementation is not recommended for pregnant women to improve maternal and perinatal outcomes. For pregnant women with high daily caffeine intake, more than 300 milligrams per day, lowering daily caffeine intake during pregnancy is recommended to reduce risk of pregnancy loss and low birth weight neonates. A healthy lifestyle includes aerobic physical activity and strength conditioning exercise aimed at maintaining a good level of fitness throughout pregnancy. Physical training decreases edema during the pregnancy, glucose level in the blood, therefore make a prophylaxis of gestational diabetes mellitus. Women should choose activities with minimal risk of loss of balance and fetal trauma. Most normal gestational weight gain occurs after 20 weeks of gestation, and the definition of normal is subject of regional variations, but should take into consideration pregnant body mass index, BMI. According to the Institute of Medicine classification, women who are underweight and at the start of pregnancy, BMI less than 80.5 kilogram per meter, should aim to gain 12.5 up to 80 kilograms. Women who are normal weight at the start of pregnancy should aim to gain 11.5 to up to 16 kilograms. Overweight women with BMI from 25 to 30 kilogram per meter should aim to gain from 7 up to 11.5 kilogram. And obese women with BMI more than 30 kilogram per meter should aim to gain not more than 9 kilograms. Maternal and fetal assessment. Recommendation B1.1. Full blood count testing is the recommended method for diagnosing anemia during pregnancy. In settings where full blood count testing is not available, on-site hemoglobin testing with the hemoglobinometers is recommended over the use of the hemoglobin color scale and as the method of diagnosing anemia in pregnancy. In setting where anemia in pregnant women is a severe public health problem, where at least 4% of pregnant women have blood hemoglobin concentration less than 110 grams per liter. A daily dose is from 60 milligrams to 120 milligrams of elementary iron until her hemoglobin concentration rises to normal, more than 110 grams per liter or higher. Midstream urine culture is a recommended method for diagnosing asymptomatic bacteriuria in pregnancy. In setting where urine culture is not available, on-site midstream urine gram staining is recommended over the use of dipstick test as a method of diagnosing asymptomatic bacteriuria in pregnancy. In the site or above is present urine culture. The pictures below are demonstrate the gram staining. Clinical injury about the possibility of intimate partner violence should be strongly considered at antenatal care visit when assessing condition that may be caused or complicated by intimate partner violence in order to improve clinical diagnosis and subsequent care where there is a capacity to provide a supportive response. 1 in 3 women experience domestic violence by their partners. Gestational diabetes mellitus. Hyperglycemia, first detected in any time during pregnancy, should be classified as either gestational diabetes mellitus or diabetes mellitus in pregnancy according to WHO criteria. Gestational diabetes. Mother's blood brings extra glucose to fetus. The fetus makes more insulin to handle the extra glucose. Extra glucose gets stored as fat and fetus becomes larger than normal. Here you can see fetus with from mother with diabetes mellitus and normal fetus, normal infant. Tobacco use. Healthcare providers should ask all pregnant women about their tobacco use, past and present, and exposure to second-hand smoke is earliest possible in pregnancy at every antenatal care visit. Substance use. Healthcare providers should ask all pregnant women about their use of alcohol and other substances, past and present, as early as possible in the pregnancy and at every antenatal care visit. Human immunodeficiency virus and syphilis. In high prevalence setting, a provider initiated testing and counseling for HIV should be considered a routine component of the package of care for pregnancy women in all antenatal care settings. In low prevalence setting, high prevalence provider initiated testing and counseling can be considered for pregnant women and antenatal care settings as a key of component to effort of the effort to eliminate mother-to-child transmission of HIV and to integrate HIV testing with syphilis, viral or other key tests as relevant to the setting and to strengthen the underlying maternal and child health system. Congenital, in vertical, you must see here the spread of HIV all over the world. The vertical transmission rate is from 30 to 80% before treatment, with 90% of all infants infected prenatally being born in sub-Saharan Africa. Congenital syphilis is characterized by having rhinitis, specific rhinitis, hepatosplenomegaly. It can be more up to 9 times than in normal hepatitis and splenum. Diffuse infiltration of the skin by an infant also is present here. Tuberculosis. Tuberculosis in pregnancy. In setting where the tuberculosis prevalence in the general population is 100 among 100,000 population or higher, systematic screening for active tuberculosis should be considered for pregnant women as a part of antenatal care. Fetal assessment. Daily fetal assessment movement counting. Daily fetal movement counting, such as with count to 10 kick charts, is only recommended in the context of rigorous research. Replacing symphysis fundal height measurement. Replacing abdominal palpation with symphysis fundal height measurement for the assessment of fetal growth is not recommended to improve perinatal outcomes. A change from that usually practice, abdominal palpation or CFH measurement in a particular setting as is not recommended. In this picture, you can see the principle of measurement from symphysis to the uterine fundus. Ultrasound scan. For over 40 years, ultrasound scans have been used during pregnancy with no known side effects. It is safe and forms an essential part of ensuring your baby is developing well in the womb. In this slide, presenting a reglement of sonography attending in the first semester in 11th till 40 pregnancy week. Second, in the second trimester in 18 up to 22nd pregnancy week. And in third trimester, in 28 up to 34 pregnancy week. First, ultrasound scan for pregnant woman is recommended but not essential to pass before first prenatal screening in 6 up to 8 pregnancy week to prevent ectopic pregnancy, pregnancy complications like a molar pregnancy, and miscarriage. Doppler ultrasound of fetal blood vessels. Routine Doppler ultrasound examination is not recommended for pregnant women to improve maternal and perinatal outcomes. A single Doppler ultrasound examination of fetal blood vessels is not for all pregnant women in the third trimester needs rigorous evaluation. Preventive measures. Antibiotics for asymptomatic bacteriuria. A 7-day antibiotic regimen is recommended for all pregnant women with asymptomatic bacteriuria to prevent persistent bacteriuria, preterm birth, and low birth weight. Rhesus disease. Antenatal prophylaxis. I must mention about rhesus sensibilization of fetus. If rhesus negative woman got a pregnancy from rhesus positive man, her future baby can be hurt by rhesus antibodies. Rhesus antibodies from rhesus positive fetus. Then a newborn might have hemolytic disease, which are characterized by anemia, hepatosplenomegaly, toxic encephalopathy. Here is a characteristic of rhesus disease sensibilization. Danger occurs only when the mother is rhesus negative and the father rhesus positive, and the child inherits the rhesus positive factor. Mother can receive a short anti-rhesus plus antibodies to prevent a buildup of rhesus positive antibodies. Preventive antihelmintic treatment. And in endemic areas, a preventive antihelmintic treatment is recommended for pregnant women after first trimester as a part of worm infection reduction programs. Preventive chemotherapy, deworming, is using single dose of albendazole or mebendazole is recommended as a public health intervention for pregnant women after the first trimester who live in areas where both first baseline prevalence of hookworm and or trichura infection is at 20% and more, and where anemia is severe public health problem with prevalence 40% and high among pregnant women in order to reduce the burden of hookworm and trichura infection. Dangerous signs of pregnancy. The appearance of bleeding from vagina, headache, blurred vision, or flashing lights in front of eyes. Swelling the face, hands, legs, abdomen, sacrum suddenly appeared. Shortness of breath, high fever, severe weakness, pain in the abdomen and in the stomach, lack of fetal movement within 24 hours, constant vomiting. Emotional and psychological and social needs of pregnant women are the part of antenatal care. Mental preparation, free and frank talk on all aspects of pregnancy and delivery. Mothercraft classes and the beneficial. Family planning, more receptive. Pediatric component includes care to under 5 accompanying the mother. Thank you for your attention.